Good afternoon, everyone. We are going to get started in just a moment. We're having a little bit of technical difficulties with Deputy Woodland's camera, and you should be on shortly.
Am I up?
Yes, we can hear you and see you.
All right. Thank you for that. Good afternoon, everyone. I'd like to welcome you to the July 16th Provider DDS Community and Provider Forum. My name is Winslow Woodland. I'm Deputy Director for the Developmental Disability Administration. And I am sitting in for
1 second. So we need to, I don't see an interpreter.
She's on my screen. I don't know if she's on yours.
Yes, I can see her. I'm not sure if she can hear you though.
Grace, can you hear me?
Looks like that's a no.
All right, everyone. I will wait until our interpreter is connected. So we have a note in the chat is that the interpreter is having challenges connecting, so we have to wait.
Just 1 second.
Mm-hmm. So good afternoon again, everyone. Welcome to the July 16th, 2020 DDS Community and Provider Forum. My name is Winslow Woodland. I'm Deputy Director for the Developmental Disabilities Administration, and I'll be sitting in for Director Andrew Reese today. We'd like to start with, as usual, sharing our COVID data, and I'm going to be sharing my screen with you. Can everyone let me know when they see my screen, or someone can let me know when they see my screen? Are you all seeing my screen now?
We are not. Okay, yes, it's coming up.
All right, are you seeing the presentation?
We are.
All right. So, as of today, we still remain at 429 people who have tested positive for COVID-19. We have had no cases, confirmed cases in June or July. And percentages of infection by placement type. Did my screen change over? Are you seeing the pie chart?
Yes, we are.
Okay. So here we have the percentages of positive cases relative to the overall number of people in that placement type since the beginning of the pandemic. And in terms of infection rate and death rate, the red bar indicates the percentages of people who have tested positive for COVID relative to the percentage of people in their respective settings. So of all COVID cases, we have a total of 38% of the positive cases and of relative to people in ICF is 38%. Residential rehabilitation, it is 33%. And supported living, it's 22%. And then the death rate is 21% in ICFs relative to the overall number of deaths. The natural homes is 8.9%, residential rehabilitation is 8.1%, and supported living is 10%. And overall, we have a 13% death rate. And in terms of confirmed death rate, we have 11.4% in intermediate care facilities, 8.9% in natural homes, 5.4% residential rehabilitation, and overall 8%. So these numbers are those people who, and I'm just going to skip to the next slide. Those are people, those are deaths that have been confirmed by the Office of the Chief Medical Examiner. Here we have our distribution of positive cases by setting, by month. Again, thankfully, in May, June, July, we have seen a significant decrease into the positive findings. People who required inpatient treatment, I had a discussion with a group earlier. We had 140 positive cases in April of 2020, and 80 of those people required inpatient hospitalization. And as you can see, people who've tested positive since then have a relatively low number of needing to use inpatient treatment. In terms of overall death rate, we did have a person expire last week who had tested positive in fall of 2020. So as you know, we would include that in the overall number. Pending confirmation from the OCME, we are fairly positive that that death was not related to COVID, but we are being consistent in how we track that. And in this slide, we show the number of people who have been confirmed as having expired relative to COVID. So of the 58 overall deaths, 37 have been confirmed as being related, presumed related to COVID. And then the number 21 is outstanding. There are 7 cases that we would need confirmation whether they were COVID, but there are 14 of those 58 are confirmed as not COVID related. So the number increased to 7 that we would need confirmation on. provider staff, we have 697 provider staff who've tested positive for COVID, and 51 of those staff work for more than one provider. And sadly, 10 of those staff have died of COVID-19. In terms of vaccination rate, currently people supported by DDA, we have a 75% vaccination rate. That is, that people who have received at least one vaccine, and this was updated. I should have changed that. That was updated yesterday. I thought I changed this slide, but this number is updated since yesterday. Host homes, we are up to 75% vaccination rate, and in parentheses, the latest update. So we were at 72% for host homes. We're now at 75%. In ICS, we were at 96%. We're now at 97%. And in natural homes, we were at 57%. We're now at 58%. In residential habilitation, we're standing steady at 94%. In supported living, we're standing steady at 83%. And provider staff, we have 61%, and that is up, I believe, from 59%. And I'll confirm. Wait a minute, let me see. I have that now. Yeah, so we are pleased that we have seen increases in just about all areas, but we still are not satisfied with those numbers, particularly in the natural homes. And what we do know is that people in natural homes have required some education and encouragement. We've provided that to approximately 300 people. And the latest, the previous provider staff percentages were 58%, and we're showing a small uptick at 61%. And that is our COVID-related data. We will just like to add that, one thing I'd just like to start off with, we did have an inquiry of a staff member was looking to complete a visit, a face-to-face visit within one of our provider locations. And the staff at the provider location was asking that our staff present evidence of having been vaccinated. And of course, that is not a requirement. And I was able to speak with the CEO of that company to clarify, and they will be speaking with their staff so that their staff is able to understand what the current requirements are. So I see one question is, when was the provider staff vaccination rate last updated? That will be yesterday. I think it's listed on the slide. I thought it was anyway. And so what I would like to do now is to take any questions that people have, because to date we have not had any questions come in formally through our portal or either via email.
Winslow, if it's okay, I'd like to give a brief update on the updated guidance that posted, if now's a good time to do that.
Sure. Ladies and gentlemen, we have Nelson Vanucci from DC Health.
Thank you, everybody. As I said last week, DC has moved into phase 3 of reopening. And on Wednesday, the 14th, there was new guidance that posted for ICFs, supported living, and CRFs. I do apologize that guidance does say July 6th is when it was updated, and that is going to be corrected, but I can tell you that it posted on the 14th, and it is the most up-to-date guidance that DC Health is providing. So the changes are brief. I won't go into too much detail because there isn't really that much that's changed, but they are as follows. The ICF guidance was updated to remove language related to size limits for gatherings. There was added language to remind that group size and activity space must still allow for social distancing as required when unvaccinated or immunocompromised persons are present or participating in the activity. And some updated language to the risk assessment requirements to say that risk assessment for outings is needed to evaluate the need for quarantine while DC is in phase 2 of reopening and should still be strongly considered in phase 3. ICF visitation guidance was updated with clarification language to include what needs to be recorded for those visiting the facility, full name, phone number, full home address, and email, and that those records need to still be maintained for 30 days to assist with contact tracing. In the event that it's necessary, that information is still required to be furnished to DC Health within 12 hours of it being requested. And this is to bring it in line with requirements for our other healthcare facilities as it relates to documentation of visitors and contact tracing or furnishing of contact tracing information. In the ICF visitation guidance, we also removed the language related to size limits for gatherings. For supported living and CRF guidance, the only change was that we removed language related to size limits for gatherings in that as well. Also remember, even with the size limits removed, when you're having a gathering, your space still should allow for social distancing if it's necessary for those that have gatherings with unvaccinated or not fully vaccinated and immunocompromised persons. That's all I have as far as the updates are concerned. Also, I talked a little bit last week about the changes to eye protection while DC is in phase 3. Just as a quick reminder, eye protection, universal eye protection is relaxed now. It is still required for standard and transmission-based precautions. And what that means for standard precautions is anytime there's a risk of splash sprays or things of that nature. And then for transmission-based precautions, you would still wear eye protection when interacting with those that are COVID-19 positive, suspected for COVID-19 or under quarantine with symptoms.
Thank you very much, Nelson, for that update. And there's a question, although DC staff can't be required to show vaccination verification, presumably they are following all visitor precautions, mask, temperature check, etc. when they visit home. It's a very good point. Our staff absolutely have been provided instructions on following the guidelines as is currently written and have been provided PPE to include mask and face shields for visitation, even though face shields have been, the guidance has changed. The DC ARP plan indicates that there will be reimbursements for DSP VAX programs at providers. What will be the approval per DSP allocation? That is formally has not been finalized with regard to, so for those unfamiliar with the question, our ARPA funding request includes a proposal to provide resources and or incentives to providers to offer to their staff to encourage their staff to be vaccinated. We have not come to a conclusion in terms of what the per DSP allocation will be at this time. Is DDS going to require us to provide a refusal protocol form for those who do not want to take the vaccine? I'm sort of trying to really understand the question because the vaccine is not an ordered medication or treatment, and our refusal protocol is based on a clinician ordering a particular medication and or procedure for a person, and the person has chosen not to adhere to that particular order, which is their right. So it's a little different because currently the vaccine is a voluntary process. A person can choose not to take it without having to go through a refusal protocol. Hopefully that answered the question. At this time, what I would do is ask if there are any announcements that could be shared for the benefit of the group. I should note that Project Action has its annual membership, monthly membership meeting tomorrow, and that is a virtual meeting. I think it starts at 9. And then that is for people to catch up and have some time to share with one another prior to the actual meeting, which I believe, let me give you the exact time. I think it starts at 10 of 10, or is it 10? I'll tell you in a second. And I believe we have the link, and we'll share that so that people can have that. Thank you, Amy Brooks, for confirming that for me. It is at 10 a.m. And I'm going to post a link in the chat for those who may not have it. And for those who don't know, Project Action is a self-advocacy group. Oh, there you go, Crystal. A little faster on the draw than I am. Thank you. Project Action is a self-advocacy group that is led by advocates who are very capable and very much concerned with advocating for their rights and the rights of others, and has done some great work over the years and have been a regular contributor to initiatives and efforts that DDA has put forth, and we truly appreciate their participation in all of those stakeholder engagement efforts.
Winslow, I just wanted to clarify something. So on the the DC guidance page, unfortunately there are 2 links, but please, the most updated guidance is the one that's labeled for July 6th. So right now it's currently showing 2 links.
So you're saying if a person were to go to the coronavirus.dc.gov website, they would have 2 links
Yes.
for guidance. Could you post the current link for the benefit of those on this call?
Daryl just posted it.
Oh, okay.
Yeah, I apologize for that. Thank you, Andrea. I actually caught that and I didn't even catch that, but the old May 3rd guidance link is still there. We're going to get that removed. And like I said, there also will get them to update the July 6th date to July 14th when the guidance actually posted, so that there's no confusion. We'll get that resolved. I do apologize.
All right. Just for the benefit of information and filling space, since we don't have questions in the chat, our staff at DDA have been returning to the office this week, have been met with cheers and encouragement, and we, those who've been coming in like to the office throughout the onset of the public health emergency, have been getting used to seeing people moving around, and we're very encouraged by what we're seeing. People are very enthusiastic, and I should add, eager to visit with people that we support. Has there been a new update as far as the Appendix K for day programs? Well, we, working with DHCF, have responded to inquiries from CMS regarding our Appendix K submission. And I'm not clear on when you say a new update as far as the Appendix K for day programs. If you could be a little more specific, I could attempt to answer that question more fully. We have submitted the Appendix K, and we have responded to requests for information from CMS on our submission. And that's all been done. For those who may know her, I wanted people to know that Amber Ohane, hopefully I didn't butcher that, Ohane, a valued member of the DD Council and active independent living advocate, passed away this week. Please join the DD Council in grieving her loss. We are so very sorry to hear of passing of a valued member of the DD Council. And I would just ask everyone to keep her family in your thoughts and prayers with regard to her loss. Thank you for that information, Carol. So we have, my apologies, I should have said approval. So if I read that correctly, has there been an approval as far as the Appendix K for day programs? I guess that's what the question is, because the follow-up is, I should have said approval. We have not received the final approval of our submission yet. But based on our latest call we had with CMS in clarifying their questions, so we submitted, and they had questions, and in that call, which was Friday before last, we were very much encouraged by the responses that were given under DHCF. Literally did an excellent job of conveying the concerns to CMS, as well as having had collaboration with DDS, to be able to answer all the questions CMS had and get to the nuance of the question. So we're very confident that what we submitted will be approved, because we haven't received any additional inquiries. So with regard to the question regarding the day programs, we should just add that the retainer payments for day programs have not yet been submitted, not yet submitted to CMS. We were advised that it's best to submit that separate and aside from the previous submission, just to ensure that we don't have further delay. So our thoughts are to get the submission as it was initially submitted, approved, and then submit for a second round of retainer payments. Andrea, no face shields to be worn by staff and ICF, just face masks. I'm wondering if that question is directed to Andrea or Nelson. Could you respond to that?
Sure. This is Nelson or Andrea, can answer either of us, but if you remember, eye protection is still required for standard and transmission-based precaution. So that means that if you're engaged in an activity where there's the likelihood of splashes or sprays, you need to wear eye protection that's covered under standard precautions. And then also for transmission-based precautions, that would cover those with suspected or confirmed COVID-19 infection, in addition to those that are under quarantine with symptoms. So those are the instances in where you would still need to wear, a face shield or some sort of eye protection.
Thanks, Nelson. So at the rate that our questions are coming in, I'll give it maybe another 5 minutes. If people don't have questions, then we can absolutely give you a few minutes of your day back, but we definitely want to be here. Make sure we answer any of your questions if you have them. I do know at a certain point, questions have been asked and answered, and we probably have covered most of the questions that people have, and nothing significantly has changed with regard to the number of people testing positive. We've been very encouraged by the mitigation training strategies that have been provided throughout the community. So we're pleased. Is that change in guidance only for ICFs or supported living as well? That was unclear to me. The phone kept going out.
Sure, the guidance has been changed for all settings. And I also just want to share, that being said, there are certain facilities that have reached out to us as we've relaxed some of the eye protection and expressed concern about doing so. I just want to remind that facilities can always be more strict than DC health guidance, but not less so. So if they feel that in their setting, for whatever reason, they have higher risk or they're more comfortable, they're certainly able to keep wearing eye protection when caring for patients. That's an individual operational decision that can be made at the facility level.
And just so there is no confusion, while being more strict, they cannot require DDA staff to have vaccination cards prior to visitation.
Winslow, I just wanted to highlight it also applies to QAPMA staff as well, our quality resource specialists.
Oh, sorry for that. Any DDS staff, DC health staff. Well, folks, looks like we can wrap this call up. Just hope everyone stays safe, and we will meet with you again next Friday. Please get your questions in during the week should they come up, and we'll talk to you next Friday. Bye.